Hello everyone, welcome to my channel. We are learning Ayurveda, Rasashastra and Ayurvedic Pharmaceutics in a simple and scientific way. Today we are going to explore Swadishta Virechana Churna in complete details. Do you suffer from constipation, itching skin diseases, piles or toxins build up in the body? Did you know that Ayurveda described a gentle detox medicine centuries ago that can safely cleanse the intestine without causing strong purgation? This medicine is called Swadishta Virechana Churna. In today's video, we will understand how this classical Ayurvedic formulation works, why it is safe even for weak patients, and how it detoxifies the body naturally. The classical reference: Swadishta Virechana Churna is mentioned in the classical text Rasashastra Sar va Siddha Sangraha. It is described under Kharaliya Rasayan preparations. The medicine is mainly used for Mridu Virechana, meaning mild and gentle purgation. What is Swadishta Virechana Churna? Swadishta Virechana Churna is a classical Ayurvedic herbo-mineral formulations used mainly for mild purgation and detoxification. In Ayurveda, accumulation of ama is considered one of the main cause of many diseases. These formulations helps the body eliminate these toxins through controlled bowel cleansing, which improves digestion, skin health and metabolism. Classical shloka describe this formulation is Swarnapatri Yashtimadhu Mishraya Gandhakam Tatha Sharkara Samayogena Swadishtam Virechanam Smrutam. This verse explains that when Sena means Swarnapatri, Yashtimadhu, Mishraya, purified sulfur and sugar are combined together, they form Swadishta Virechana, a mild purgative formulation. The formulation contains 5 important ingredients. First is a Swarnapatri, second Yashtimadhu, third Mishraya, fourth Shuddha Gandha and fifth is a Sharkara. Each ingredient has a specific role in that formulation. The classical proportion is usually Swarnapatri taken as a 3 parts, Yashtimadhu 1 part, Mishraya taken as a 1 part, purified sulfur taken as a 1 part and sugar taken as a 4 part. Here Swarnapatri produces laxative action, Yashtimadhu protects the intestinal lining, Mishraya prevents abdominal cramps and Gandhaka helps detoxification, and sugar balance the formulation and improve taste. Now we will see the method of preparation. The preparation process followed traditional Ayurvedic pharmaceutical procedures. First, all ingredients are cleaned properly. Purified Gandhaka is prepared through Gandhaka Shodhan as important Rasashastra purification process. The herbal ingredients are shaded, dried and powdered separately. The powdered are passes through the mesh AT sieve to obtain fine particles. Sugar is powdered separately. All powdered are mixed thoroughly and triturated in a khalva yantra to obtain a homogeneous mixture. The final churna is stored in airtight container to prevent moisture contamination. Now we will see the dose. The general dosage is adults 3 to 6 grams, in children's 50 to 100 mg per kilogram body weight, in elderly patient taken as an around 3 grams, in pregnant woman usually starts with 2 grams if necessary. The maximum dose should not exceed 6 grams per day. Now we will see the Anupana. The medicine is usually taken with lukewarm water. In some cases it may also be taken with warm milk or honey, but lukewarm water is the most commonly recommended Anupana. Now we will see the Prayog Vidhi. Swadishta Virechana Churna is usually taken at night before sleeping. This allows the medicine to act overnight. The bowel movement usually occurs naturally the next morning. Now we will see the Rasa Panchaka of ingredients. Let us now understand the Ayurvedic properties. Swarnapatri has a Tikta and Kashaya Rasa with Ushna Virya and produces purgation. Yashtimadhu has Madhur Ras and Shita Virya, which protects the mucosal lining of the digestive tract. Mishraya improves digestion and reduces intestinal cramps. Purified sulfur supports detoxification and helps relieving itching in skin diseases. Sugar provides cooling and balancing effect. Now we will see the overall of Rasa Panchaka. When all ingredients are combined, the formulation shows Madhur Tikta Kashaya Ras, Laghu and slightly Snigdha Guna, predominantly Ushna Virya and Madhur Vipak, and Mridu Virechana is a Prabhav. Swadishta Virechana Churna mainly works through Mridu Virechana, Anuloman, Pitta Shaman, Rakta Shodhan and Apachan. Here we will see the therapeutic indications. In Vibandha, it softens the stool and stimulates bowel movement due to Swarnapatri, and Gandhaka and Yashtimadhu adds lubrication, while Mishraya reduces the gases. As a result, easily evacuation occurs and Apanvata normalization. In Kustha, Swadishta Virechana Churna works by detoxifying Pitta and Rakta. Virechana removes toxins, Gandhaka purified blood and reduces inflammation. As a result, to improve the skin health and reduces the lesions. Then in Kandu acts through Rakta Shodhana and Pitta elimination. As a result, relief from itching, burning and irritation. In Arsha, it removes the root cause, that is constipation. It softens the stool, reduces straining, and Yashtimadhu decreases inflammation. As a result, relief in pain, swelling and bleeding piles. In Shurashula, like headache due to constipation, removes intestinal toxins and gases, which are the root causes of this Shurashula. So improves the digestion and regulates Vata. As a result, relief from headache and heaviness. In Amaruddhi, it improves Agni and eliminates Ama through purgation. As a result, body detoxified and metabolic correction. Overall, the therapeutic mechanism is the combined action of the formulation includes Mridu Virechana, Anuloma, Pitta Shaman, Rakta Shodhan and Apachana. Thus, Swadishta Virechana Churna works as a detoxifying, laxative and blood purifying formulations. Now we will see pharmacological actions. The major active ingredients is senna leaves, which contain senosides. This compound stimulates intestinal muscles and increase bowel movement. Yashtimadhu protects the intestinal lining. Mishraya reduces the cramps. Purified sulfur contributes to detoxification and helps reduce skin itching. Because of this balanced composition, the formulation produces effective laxation and with minimal side effects. Now we will see the contraindications here. Despite being gentle, the medicine should not be used in certain conditions such as severe diarrhea, intestinal obstructions, severe dehydration, inflammatory bowel diseases. Always consult qualified Ayurvedic physicians before using purgative medicines. Now we will see the Pathya. For better result, diet is very important. Recommended food includes light diet, rice and moong dal, warm water, easily digestible foods. Foods to avoid include spicy food, fried food, alcohol and excess sour foods. Now we will see the shelf life. According to classical Ayurvedic text, Churna formulation have a shelf life of about 2 months. However, according to modern pharmaceutical standards, the shelf life can be extended up to 2 years when stored properly. Now we will see the quality controls, that is a physicochemical standards. To maintain quality, the formulation is evaluated according to standards of the Ayurvedic Pharmacopoeia of India. Here, loss on drying should not exceed 10%, total ash should not exceed 15%, acid insoluble ash should not exceed 5%, water soluble extractive should not at least 20%, should be at least 20%, alcohol soluble extractive should be at least 10%, particle size should pass through an 80 mesh sieves. These parameters ensure the medicine is safe, pure and effective. Now we will conclude here. So this was a complete explanation of Swadishta Virechana Churna, one of the classical Ayurvedic formulations used for gentle detoxification and relief from constipation. Understanding classical formulations like this help us appropriate the scientific depth of Ayurveda and Rasashastra. If you found this video useful, please like the video, share it with your friends and classmates, and subscribe to the channel for more educational videos on Ayurveda, Rasashastra and Ayurvedic pharmaceutics. Also, comments below and tell me which Ayurvedic formulation should I explain in the next video. Thank you for watching. See you in the next video. Dhanyavad.